On this Friday night, American approval to import Canadian medicine. Florida gets U.S. federal permission to get pharmaceuticals from north of the border. The long-demanded policy change that could impact Canadians. Sole survivor. The piercing words in court of an 11-year-old boy whose family was killed in an attack on Muslims.
He has the greatest loss here. His parents, his sister, his grandmother.
Plus, a Canadian soldier defending Ukraine.
This is not a morally unclear war, and I knew that I could help.
The Ontario man risking it all on the front lines to fight Russia's invasion. And a closer look at the deadly collision at a Tokyo airport. How so many lives were saved, and what does it mean for air travel safety in Canada?
Global National with Farah Nasser. Reporting tonight, Carolyn Jarvis.
Good evening and thanks for joining us. We begin tonight with a groundbreaking decision in the U.S. that could impact Canadians. Florida has become the first state to get FDA approval to mass import prescription drugs from wholesalers here, where prices are much lower. A recent survey shows Americans who ordered their prescriptions from Canadian pharmacies saved nearly $5,000 last year. U.S. states have long fought to purchase medicines in bulk to rein in some of the highest drug prices in the world. Mackenzie Gray reports on the policy shift and the potential impact in Canada.
A decades-long dream could soon be coming true for some unwell Americans. The U.S. Food and Drug Administration approving a request to have Canadian drugs shipped to Florida in bulk to help cut down on sky-high U.S. prices.
Florida population is, half the size of the Canadian one. This is not a small jurisdiction.
The Sunshine State will now be allowed to buy large quantities of Canadian-made generic drugs that treat illnesses like HIV, AIDS, diabetes, and hepatitis C. And 8 other states are looking to follow suit. But the impact on Canadians is likely to be limited for now, thanks to a regulation Ottawa implemented in 2020, prohibiting the sale of medicine meant for the Canadian market that's in short supply, and forcing new rules on drug wholesalers.
If you know that there's any drug that you could reasonably know would be in shortage in Canada, then you have an obligation not to export it.
If that doesn't stop their export, American drug manufacturers will also try, with expected court challenges to the new FDA rules.
It's subject to tremendous litigation by some of the most litigious and well-financed companies in America, if not the world. So this is probably not going to affect us too quickly.
3 major drug companies who produce insulin.
A long-standing policy on the American left, Vermont Senator Bernie Sanders, since the 1990s has been busing people to Windsor, Ontario to buy medications for substantially less. American drugs are on average 218% more expensive compared to Canadian counterparts. But it was Sanders' political polar opposite.
Florida is going to buy a lot of these for our programs.
Florida governor and Republican presidential nominee Ron DeSantis, who went to court to bring in these new rules. But they're unlikely to drive prices down.
In order for American drug prices to come down significantly, we need American policymakers to really go toe-to-toe with industry.
The health minister's office told Global News Canadians would continue to have access to the drugs that they need. But his own department admits that's not happening right now, Carolyn. Over 1,800 drugs are considered to be facing acute shortage.
Mackenzie Gray in Ottawa. Thanks, Mackenzie. It was a heart-wrenching day in an Ontario courtroom as the words of an 11-year-old boy, the sole survivor of an attack that killed 3 generations of his family, were heard. The boy's victim impact statement was one of roughly 70 at the sentencing hearing for Nathaniel Veltman, who targeted the Afzaal family with his truck in June of 2021 because they were Muslim. Global's Sean O'Shea was in the London courtroom today. Sean.
Carolyn, it was an emotional end to this part of the Nathaniel Veltman case, a landmark trial putting Canada's terrorism laws under the microscope. Now, Nathaniel Veltman was convicted on 4 charges of first-degree murder in November for killing 4 members of the Afzaal family here in London, Ontario. Prosecutors say that was an act of terrorism. Now, a jury had found he had intentionally run down the family in June of 21 when they were out for a walk, and that the family was targeted because they were Muslim. We heard from a lot of people over these last few days, a total of about 70, including a victim a friend of a victim saying that she is haunted by this nightmare that just won't go away. Many told the court that they're afraid to wear traditional Muslim clothing. They're afraid to cross the street. They talked about a loss of innocence. They talked about the fact that they don't think Canada is as tolerant as they once thought it was. But the last of the roughly 70 statements that we heard here was from an 11-year-old boy, the only surviving person in that attack, whose mother, father, sister, and grandmother were all killed. We're not naming him because of his age. The boy suffered serious injuries, including a broken leg and a broken collarbone. He said in the statement, which was read by another boy surrounded by supporters in part, "The offense has made me very sad that the fact that I can't talk to my family anymore and make new memories with them. I won't be able to have fun with them anymore." Now, the leader of a London mosque reflected on what it meant for the boy to make that statement.
We're all here to support him. What he has to say will bring together all of our sentiments, because his pain is the most intense.
The boy said he misses his grandmother's cooking, and he understands now why he had to do all that homework, even though his parents were trying to get him away from video games. The next part of this trial takes place January the 23rd. Veltman will have an opportunity to speak to the court if he wants. Then he'll be sentenced, but he'll be getting 25 years at least in jail. That's the mandatory minimum for first-degree murder. Carolyn, back to you.
Sean O'Shea in London, Ontario. Thanks, Sean. After months of job growth in Canada, the jobless rate stalled last month. According to Statistics Canada, the unemployment rate was virtually unchanged in December, holding steady at 5.8%. The economy added just 100 jobs, but there was a jump in average hourly wages. Economists say it marks the biggest wage gain in more than a year and could mean employers are paying more to retain workers ahead of a possible economic downturn. As Anne Gaviola explains, that may help solve a different problem plaguing Canada: declining productivity.
We measure productivity in the business world by cars manufactured, meals served. It's the amount of goods and services produced for every hour worked across Canada. Economists say we have a productivity problem.
Another word for productivity is often competitiveness.
Productivity in Canada has been on the decline for a year and a half. And there are a few main reasons why. Canada doesn't have an economy on the same scale as the U.S. Business experts also point to a lack of competition in many key industries. Not a lot of incentive to go the extra mile. And analysts point to a regulatory environment that holds up project approvals.
Another piece of the puzzle, a lack of investment in new ways of doing things, from more efficient equipment to automation and disruptive technology.
Imagine if I were working at essentially, in construction with a shovel versus somebody working with a backhoe.
A more recent factor is an influx of newcomers, from temporary foreign workers to refugees. Immigration has been a boon to GDP, helping to fill labor shortages. But employment analysts say integrating them into the labor market with jobs that match their strengths has been our Achilles heel.
If newcomers are going into low-paying jobs, if they're going into jobs that don't really require significant skill sets, that sort of effect can actually erode productivity.
With an economic slowdown underway, companies are finding ways to get more out of their workforce, holding off on hiring, but more willing to increase pay.
Employers are still willing to hold on to their workers because we've come off of such a tight labor market.
That may be a boost to productivity, which benefits everyone.
Since the end of the Second World War, 80% of the rise of the standard of living of Canadians has come through stronger productivity.
Anne Gaviola, Global News, Toronto.
At least one person is dead and 11 others injured after a bus heading from Montreal to New York crashed this afternoon. New York State Police are investigating. The deadly bus rollover happened about 260 kilometers south of Montreal in the Adirondack region. There were 23 people on the bus at the time. New York's governor called the rollover horrific, adding that New Yorkers are praying for everyone involved. On the eve of the third anniversary of the violent riot at the U.S. Capitol, President Joe Biden made his first campaign speech of the 2024 election, warning that former President Donald Trump's plans to retake the White House pose a grave threat to America.
Donald Trump's campaign is about him, not America, not you. He's willing to sacrifice our democracy, put himself in power. Our campaign is different.
Speaking in Pennsylvania, Biden says January 6, 2021 marked a moment where we nearly lost America. Trump supporters attempted to stop Congress from certifying Biden's 2020 election win. Biden says the 2024 presidential race is all about whether American democracy will survive. He says he vows to defend, protect, and preserve it. The U.S. Secretary of State has touched down in Turkey ahead of an expected stop in Israel as fears of a wider regional conflict intensify. Antony Blinken is trying to broker a solution to end Israel's war in Gaza after Israel outlined its post-war plan that envisions a Gaza without Hamas and limited Palestinian rule. Blinken is also working to stop escalating attacks on U.S. troops and ships in the Red Sea by Iranian-backed militias without fueling a wider war. And as the fighting rages on in Gaza, the Israeli Defense Force yesterday released more video that it says shows Hamas tunnels in Khan Yunis. Also in Khan Yunis is a Canadian doctor who traveled to help with Gaza's emergency response. Yasser Khan is an ophthalmologist from Ontario. He's working at a hospital there with a team of doctors from Canada and the U.S. performing complex operations on wounded Palestinians. Here's Dr. Khan in his own words.
The human tragedy is so huge here. Almost every hour someone's coming in with an explosive injury or a serious injury. People are losing their legs, their eyes, their lives. The healthcare workers are working here 24 hours every single day with nothing, with no resources, nothing, no medications, anesthetics, everything is out. The healthcare workers here are excellent and they're doing the best job that they can despite the fact that the system is collapsing. So we had to bring her in yesterday at about 8 p.m. and take the eye out. I think that really affected me because it's a child, and a child is completely innocent and has done nothing to deserve this. I've seen more trauma when it comes to eyes than I've ever seen in my entire 20 years of practice. Every hour or so we hear bombs, the hospital shakes. The people of Gaza, the Palestinians here, just go about living their lives, saving lives, doing procedures, and almost ignoring the bombs that are going on in the background. And I think because the people of Gaza are so calm about it, it calms me as well.
That was Dr. Yasser Khan in Khan Yunis, Gaza. A Canadian in the trenches of Ukraine. Coming up, the Ontario soldier who traveled to the front lines to fight Russia's invasion. A Ukrainian parliamentary committee met this week to review proposed changes to military draft rules as the country looks for more soldiers to fight Russia's invasion. Bolstering domestic ranks are hundreds of foreign fighters, including some from Canada. Dave Smith, who lives in Ottawa, quit his role with the Canadian Armed Forces to join the front lines. Our Redmond Shannon sat down with him while he was in London on a break from the fighting.
I brought my helmet, my plate.
Oh,
now, everybody good, Speedy?
Yeah, Speedy, okay.
My ears are ringing.
20th century trench warfare in 21st century Ukraine.
At a certain point, everything just becomes like surreal and hilarious, you know? Like I just had to go pee and now there's a 122 millimeter shell flying over my head.
Canadian Dave Smith is on leave from Ukraine's armed forces. While fighting on the front lines in eastern Ukraine, several men in his unit have died. Yet he will return to Ukraine later this month. He decided to end a 15-year career with the Canadian Armed Forces last year in order to join a fight he believed in passionately.
I never really had to give anyone a reason, and all the reasons I gave my wife, she accepted, but we're still upset about. This is not a morally unclear war. And I knew that I could help.
Zero, this is 2-3 Alpha. We just had one round land like 2 meters behind the position. They're getting increasingly close. Are you having any luck with that drone over?
The Toronto native is fighting in a mostly Belarusian unit. He says his comrades see Ukraine's future intertwined with that of their own country, which is firmly under Moscow's influence.
The only difference between training in Canada versus fighting in Ukraine is the mud in Ukraine like defies physics.
This is what the mud looks like in the trench.
It gets everywhere, it's on everything, it slows you down to the point where neither us nor the Russians can really maneuver. I have told numerous people this back in the Canadian Armed Forces. All those years when I was going through the infantry school, we were always like, this is stupid, we're never gonna do this again. And all the old guys who remembered the Cold War were like, no, you have to practice clearing trenches. And they were right, and I was wrong. It's that simple.
Vladimir Putin calls soldiers like Smith mercenaries. He is paid by Ukraine, but only a fraction of his Canadian military salary.
Average Ukrainians are always thankful. You get a lot of handshaking, hugging, old ladies making sure you have something to eat and somewhere to stay.
Oh, yeah, they're back. Close.
Smith says Canada and the West cannot afford to tire in fighting against Russia's ambitions.
Just because you're morally right, like Ukraine's the righteous side of this war and we should all be supporting them, that doesn't mean we have unlimited 155 shells for them, you know? So if you want to stop people who think might makes right, you also have to be pretty mighty.
Redmond Shannon, Global News, London.
Keeping Canadian runways safe ahead. Could a deadly collision like what happened in Japan happen here? We're starting to learn more tonight about what led to a deadly crash at Tokyo's Haneda Airport on Tuesday. Recovery crews began removing the wreckage from the runway today. 5 crew members on board a Coast Guard plane were killed when it was hit by a commercial jet coming in for landing. All 379 passengers on board that flight evacuated safely. As Neethu Garsha reports, it's prompting new questions about how many close calls there are on Canadian runways.
1 in 11 million, which is the probability of any person being involved in a crash.
Nigel Waterhouse, who works in Transport Canada's Design Approval Department, says extensive testing of aircraft like this Japan Airlines plane helped ensure all 379 passengers on board got off alive after Tuesday's crash at Japan's Haneda Airport.
Everything inside an airplane is tested and it doesn't burn. The aircraft cabin is designed so that all of the passengers, well, everybody can get off within 90 seconds.
The wide-body jetliner was landing when it collided with a Coast Guard turboprop, which sources say had been stopped on the runway for nearly 40 seconds. The Japan Airlines jet kept advancing on the tarmac until it came to a standstill. The Coast Guard Dash 8 had entered the runway without permission from air traffic control. 5 of the 6 crew members on the Coast Guard plane were killed. An investigation into the collision is underway.
I'm sure what we're going to find in this investigation is that the flight crew fully believed that they were doing the right thing. So the question then is, can we drill down far enough to find out what it was that made this seem correct?
As far as whether something like what happened in Japan could happen at Canadian airports, according to the Transportation Safety Board of Canada, the runway incursion rate in this country doubled in the last decade from an average of 5.3 incursions per 100,000 arrivals and departures in 2010 to an average of 10.7 in 2021.
Those numbers, they cover all airplanes, not just passenger commercial traffic. I think there's a lot of near misses that people don't necessarily know about.
As for why air traffic controllers in Japan didn't see the Coast Guard aircraft, this retired NAV Canada manager says it can be hard to see.
Really often you look out and all you see is a blinking light in a sea of hundreds of other lights, including taxiway lights and runway lights.
This is the initial contact of the Dash 8 to the tower. So it basically announces he's on taxiway C.
Reviewing transcripts of the conversations with the control tower, Waterhouse points out the language wasn't clear.
Departing traffic is present. So Japan Airlines knew that there is another aircraft which is in the vicinity, which is getting ready to depart.
He'll be watching the investigation closely as officials aim to complete the removal of the wreckage this weekend. Neethu Garsha, Global News, Vancouver.
Lost in loneliness. Next, the Toronto hospital tackling the health issue head on. In a world where people can connect with each other in so many different ways, loneliness is a growing concern for doctors. Medical professionals say feelings of isolation can be associated with poor health, especially among seniors. Catherine Ward shows us how one hospital is trying to help those in need.
Andrew Taylor has volunteered at Mount Sinai Hospital in Toronto for 14 years.
Can I help you, sir?
Over the last year, Taylor's role has expanded from providing directions to also calling people doctors believe are at risk of loneliness.
Basically, a contact for people who are socially isolated because they're recovering from a procedure or a clinic of some kind, and they're at home and often live alone.
Dr. Jacques Lee is leading a new program at Mount Sinai and says loneliness is a critical health concern.
This is nothing I ever learned in medical school. This is nothing we've been trained to ask about or inquire, and we really don't know how to prescribe for it either. So it's a hugely impactful health problem that we're not monitoring.
Volunteers are paired with older patients who have similar interests. Calls are scheduled once a week for 3 months.
They're trying to encourage them to get out, make some goals for themselves to try and be a little bit more connected.
Lee says loneliness needs to be viewed with a medical lens.
People may have health problems that they don't connect to the fact that they're lonely.
Taylor says the program has been mutually beneficial.
It's kind of an escape for both of us, too. I mean, I think I got as much out of it as the patients.
Lee says a full analysis of the program will be done this spring. He's hopeful the data will yield positive results.
The fact that it's such a big problem and we've never done anything about it is actually an opportunity. Because that means that, hey, anything we do is going to move the bar. It's going to make it a little bit better.
Catherine Ward, Global News, Toronto.
And that is Global National for this Friday. I'm Carolyn Jarvis. Tonight's Your Canada is Regina's new feathery representative. Saskatchewan's capital unveiled its official bird today, the black-capped chickadee. More than 21,000 votes were cast in a contest that began after Regina was declared a bird-friendly city by Nature Canada. Thanks for watching. Farah is back at the desk tomorrow. Have a good night.